Hello friends, and welcome to another WSIB Truth Matters, where I separate the truth from bullshit, the facts from fiction, in plain English. In today's episode, I have a very interesting subject matter to talk about. So, and to my friends at the WSIB, here you go. My salute to you. I hope you're tuning in for this video. All right, friends, let's get at it. And welcome back. So today I was going to talk to you about the subject matter of how to get the WSIB's attention. This started back about 2 episodes ago when I talked about the 2 main tools that the WSIB has used to wage war on injured workers. The one being denying everything. And the other one is deeming injured workers uncooperative and reducing their benefits or cutting off their benefits. So last week I talked about my 10-point checklist to determine whether or not, or for you to determine whether or not you're ready for appeal, if your case is hearing ready. And so if you're in that situation now, I highly recommend that you go watch that video. That was my last week's video. And today I was going to talk about how to get the WSIB's attention. Because they don't seem to care. And I'm sure most of you, whether you have a recent claim or you have a claim that was from a year, 5 years, 10 years, it's pretty much been the same all the time. And having done this for over 30 years, I can tell you that not a whole lot has changed, except for one thing. And that's what I want to talk to you about today. The one thing that the WSIB has engaged in, more aggressively than I have ever seen them do that. And they've played these tactics over the years. I've seen this happen many, many times, but not to this extent. And that is that they are making decisions on a regular basis, decisions that are healthcare based, that should be made by your doctors and your specialists, by professionals, therapists, physiotherapists, occupational therapists, physiatrists, surgeons. I mean, the list goes on and on. They're the ones that should be making recommendations regarding your treatment because they're the ones that are treating you. They're the ones who have assessed you. They're the ones who have done tests to try and ascertain what your condition is, to provide a diagnosis and then a treatment plan. These assholes deny everything, okay? There isn't one single case manager that I have ever come across who has a medical background. And what I mean by a medical background is someone who's actually licensed as a physician with the College of Physicians and Surgeons in Ontario, or another healthcare professional that is licensed under the physiotherapists, acupuncturists, occupational therapists, and so on and so on. They are regulated, and they make sure that they keep up to date on rules and regulations and laws, and of course, the more and more recent treatment plans that can work in certain situations. It's them, not these guys at the WSIB who are summarily making decisions about your healthcare and denying healthcare. In some cases, they have a nurse consultant. I don't really give a shit about the nurse consultant. How the fuck does a nurse consultant overrule your doctor who's treated you and who's seen you? Shouldn't be necessary. Those decisions should be made by the professionals, the people who are treating you. And yet, the WSIB has engaged in this consistently, mercilessly, and without regard for any of the possible repercussions. And the fact that denying treatment and preventing you from having treatment can cause your condition to get worse, much worse, and in some cases to the point where it becomes permanent. But they engage in this sort of nonsense all the time. It's sick, and it needs to stop. I'm on to you. I've done my research. I'm paying attention. I have the finger in the pulse. And I'm dealing with the fat cats who are pulling the strings on the frontline decision makers. But they're not putting their names on a document. They're not saying, I, Vice President of Claims Management, am denying this treatment and signing it at the bottom. They don't do that because they're fucking cowards. They relegate this to the frontline decision makers, case managers, and eligibility adjudicators. And these are people that I don't have issues with them, although some of them are just totally ignorant in the way that they treat injured workers, because I've witnessed this myself personally. I've seen it happen many times. The way they behave themselves with injured workers who need help, who need their questions answered. But a lot of them really shouldn't be the ones that are having to bear the burden of what's going on here. Because this is a game. This is a sick game. But you know what? The stakes are going to be high for those of you who think that you can continue to do this. This is what the law states. Not a WSIB case manager or a return to work specialist or a manager or director or one of their 20 fucking vice presidents or the chief operating officer and all of the members of their board. And I happen to know who all of them who they are because I keep tabs on everybody. And their president, Jeff Lang. The stakes are high because you're making decisions that's causing a lot of harm to injured workers. I have a member that was, the cops beat the shit out of her the other day. Cut her forehead, split open, didn't even provide any care. Didn't even bother to check whether she was dead or alive. Threw her into a jail cell when she was crying out for help, for treatment, for post-traumatic stress that her case manager had denied. And the WSIB owned their own specialty clinic, mental health specialty clinic. The doctors, the psychiatrists, and the psychologists all recommended treatment. And the case manager denied it. You're doing this to thousands of people out there. And you can't get away with it. And you're not going to get away with it. Not on my watch. You're not going to get away with it. But I've been quietly putting things together to make sure that you're going to be hit where it hurts. You see, you have always been functioning as though you are immune from the law. As though you are protected from liability in the courts. The Superior Court of Justice in Ontario, that all of us are subjected to if we violate the law. But you think that you're immune from that you are untouchable. And your lawyers and your policy analysts will tell you, oh yeah, don't worry about it. You're covered. You're covered by the Workplace Safety and Insurance Act. You can say whatever the hell you do or want. Doesn't matter. Nobody can sue you. There's no repercussions. That's what they do. But you know what? Recently, there have been 2 Ontario court decisions where the WSIB, you got spanked hard, really hard. But nobody's ever challenged this one. Here's what the law states. Section 33, subsection 1 and subsection 2 of the Workplace Safety and Insurance Act. I'm going to read it to you. The Workplace Safety and Insurance Act states a worker who sustains an injury is entitled to such health care as may be necessary, appropriate, and sufficient as a result of the injury. That's what it states. It doesn't give case managers who have no medical training or other decision makers within the WSIB the power to determine how much treatment is necessary or sufficient, or how much treatment you should have as a result of your injury. That is not in the act. It's not in the law. Nowhere. But somehow you guys have taken that and created a policy Your policy that wasn't written by legislators who wrote that section into the law as to how you're going to deal with it, on how you can be justified in denying treatment for a worker who desperately needs it. That is going to fucking stop. You see, you've never had any skin in the game to this point. There haven't been any repercussions yet. But they're coming. And I don't make threats or promises in vain. You know me by now. I don't do that. I follow through with it. It's taken me months to put it together, to decide, you know what? It's about time that we hold the fire to the feet so they can feel the fucking heat and start having to justify their actions. And the only way that's going to happen is in a court of law. Because a judge will want to hear all about it, I can tell you. Two decisions of much less significance, because nothing is more significant in the management of your WSIB claim than that section of the law, section 33, subsection 1, subsection 2. Why? Because every decision the WSIB makes is based on medical. Every single one. The decision to provide you with loss of earnings benefits, it has to show, the medical has to show that you're disabled. And even then, they'll cut you off whenever they want. The decision to provide you with healthcare treatment is based on whether there's medical to support the fact that you need treatment. The decision that you're not able to go back to your previous job and you have permanent restrictions, it's a medical decision that you can disagree with. Every single decision made by the WSIB will stem from how they employ or how they adjudicate and apply section 33, subsection 1, subsection 2 of the Workplace Safety and Insurance Act. And they use that section to deny all of these things without having to remotely concern themselves about the possible repercussions of denying you something, the worker, something that they need, and that person getting worse or much worse than that, taking their own lives. And that has been happening at an alarming rate. There's an issue of morality and ethics. And I often like to talk about these because they're important. Morality is about doing what is right, where your humanity tells you that this is what you need to do because it's right. I'm sure your parents told you and taught you between right and wrong. And the other one is ethics. And that means that if you have a governing body and that if you have a legislation and you have policies, that you have an ethical responsibility to adhere to those laws and policies. Morality and ethics. And I can tell you, WSIB, you have none. You are corrupt. A cesspool of garbage. It's time that you take action, or it's time that you learn that what you do and how it impacts others can come back to haunt you. So my friends, for those of you who are interested, send me an email. I am creating a group. We have one currently we're working on, which is the class action lawsuit for the WSIB's position on deeming. That has to do with return to work. That has to do with how they use their crystal ball to deem how much you're going to earn, reduce your benefits, and then you're screwed. We're dealing with that one. This one now is to deal with medical appeals. Forget appeals. It's to deal with any time that you have been denied treatment by the WSIB, and by having been denied that treatment, your condition got worse. If you want to put on that list, send me an email with your name and your information. That's all I need. It's a confidential list, and we will continue to add to that list. But I can tell you the number of plaintiffs will be in the thousands. I can tell you that. I'm telling you thousands, which could potentially bankrupt this organization and put these people out of a job, which is exactly what I would like to see happen. Thousands, because they're denying people by the thousands, mercilessly, without any regard for them or their families or their health. They don't give a shit, and they think they're protected. My email is up here. Please send me your name and information, because we're going to continue with this process. And when we believe that we have enough plaintiffs to make a real statement to the courts, we'll let you know. We're going to communicate with you individually and separately, because it is confidential, and will not disclose any of your information to any of the others on the list or anyone else until such time as you're presented with the options as to what to do and whether or not you would like to participate at that point as a plaintiff. All of that information will be provided. All right, friends? But it's time. It is time. It's time to put these assholes in their spot, because you know what? I'm sick and tired of having members desperately looking for some kind of support for healthcare and being denied by these people. All right, friends, thank you for taking the time to watch this video. Next week, I am going to talk about how to get their attention. I promise you it's going to be an interesting one, and I'm going to talk about it next week. But I thought this one couldn't wait. It just couldn't wait, based on things that I've seen over the past years, but especially in the last few months, as my investigation of this matter has come to a somewhat of a conclusion, because I needed to do some investigating to see just how bad the situation is, and it's awful. It's far worse than I had ever expected. Okay, friends, if you need help with WSIB, with your claims, any matter dealing with your WSIB claim, please visit our website, WSIBsettlements.com. We have all the tools, resources, and expertise to help you with your claim. And if this is your first time to the channel, as you can tell, I'm very passionate about what I do. I make no holds. I don't explain myself. I have no holds barred. I take no pity on the WSIB. And my disdain for them is evident in probably most, if not all, of my videos. So I welcome you to become a subscriber. That will help me to grow our subscriber base. My goal is to reach every injured worker in this province of Ontario to provide help. I have had many, many requests for help from BC to Alberta to Manitoba, Newfoundland, and I've had to put them off because we don't provide services in those areas. However, within the next 12 months, we are going to expand our legal services network to those provinces to help those people as well. Because what's happening is a nationwide epidemic. It's a real problem. And we want to make sure everybody gets covered. All right, friends. So once again, thank you for taking the time to watch this video. I hope that you saw something of value, something that can be helpful. And as always, and until next time, take care.